As a physician, I believe that patients and families should be given as much choice as possible in what happens to them toward the end of their lives. My name is Timothy Quill, and I'm a palliative care physician from the University of Rochester Medical Center in Rochester, New York. So in palliative care, we tend to see the sickest of the sick people, and a lot of people are involved in aggressive fights against their disease. Some people transition to hospice care, where we're mainly relieving pain and symptoms. And we also encounter people who are ready to die now rather than later. Medical aid in dying is currently being actively considered by the New York State Legislature. It's a lot of people who are very supportive of it. There are some people who are opposed. It's under active discussion. And now is the time to really let our legislators know what we want. And what we want is the possibility of this for people who want it. Nobody has to have this if they don't want it. It's not incompatible with hospice and palliative care and good medical care, but it is an option that puts choice much more in the hands of patients and families and less in the hands of legislators and other people who don't have their heart and soul in what happens to that individual patient. The Medical Aid in Dying Act would make this legal for New Yorkers at a time of their own choosing, should they choose to want to move in that direction. Patients and their families should be given the loudest voice in terms of what happens to them at the end of life. So if they want more choices, our job is to figure out a way to let them have that in a way that is safe, meaningful, and responsive. Please take a moment to share this thought and option with those you care about who live in New York. We're all facing this potentially in our futures. New York is ripe for such change, and we really should take action now to try to get this medical aid in dying possibility for New Yorkers like it is in 9 other states in the District of Columbia.